You cut through the water, you resurface, and that moment where you come up for air and you're safe is the completion of the trauma cycle. Peter Levine, who created somatic experiencing therapy, had talked about the completion of a trauma cycle. We go up to jump off of a diving board, right? You're standing up there, you've got like the pre-trauma symptoms. Your stomach may flip, you're feeling a little tense, you stand at the edge and you jump. And when you're jumping and you're out in the air, you're actually in trauma. Like you're in this moment where you could get hurt. You cut through the water, you resurface, and that moment where you come up for air and you're safe is the completion of the trauma cycle. But what happens with many of our traumas, whether it be because we're a child and we don't have agency over what happens to us, or we are, a battered partner, or we are, in war, or we are someone who doesn't have control over their own fertility, we don't get to complete these trauma cycles. We are often stuck in them. And so EMDR helps through bilateral stimulation using things like sound and I use these little like vibration paddles,
Yeah.
called TheraTappers. It allows the therapist to bring you into the moment that these things were being felt, but in a safe way so that you can reorganize them and maybe sometimes even change your cognitions around them. And I remember when I learned how to do it, I processed the first miscarriage, like the moment I found out about the miscarriage when I was in the office. And before doing EMDR, it felt very front of my mind. Like I could almost feel like, you well up, you get tight, that throat feeling. But after doing EMDR, it's like the memory got kind of gently moved to the back in a file where I can open it, I can look at it, I can handle it, but it's
Yeah.
not